Malaria is a mosquito-borne infectious disease that is common in tropical and subtropical regions of the world. But the question is how a person gets infected with malaria, what could have caused it, and how did the infectious agent takes over the human body. Let's learn this infectious disease in detail in this video. To answer all these questions, first we have to know about the causes of malaria. We have always heard that mosquito bites are the root cause of malaria. So, are the mosquitoes responsible for this infection? No. You will be surprised to know that mosquitoes do not cause malaria, but just spread it. And what do we mean by this? The actual causative agent of malaria is the protozoan called Plasmodium. There are 4 kinds of malaria parasites that can infect humans, which are Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and the Plasmodium falciparum. Among these, Plasmodium falciparum is the most violent and can also be life-threatening. So the question is, from where does a mosquito come into the picture? Well, the protozoan Plasmodium lives as a parasite in the female Anopheles mosquito. From there, it gets transmitted to humans with a mosquito bite. Hence, it is the infected mosquito bite which can cause malaria and not the insect itself. An infected mother can also pass the disease to her baby at birth. This is known as congenital malaria. Malaria is transmitted by blood, so it can also be transmitted through an organ transplant, a transfusion, use of shared needles and syringes. A malaria infection is generally characterized by recurrent attacks with the following signs and symptoms: moderate to severe shaking chills, high fever, sweating. Other signs and symptoms may include headache, vomiting, and diarrhea. Malaria signs and symptoms typically begin with a few weeks after being bitten by an infected mosquito. However, some types of malaria parasites can live dormant in your body for up to a year. Now, let's talk about the diagnosis of the infectious disease. Blood test can show the presence of the parasite and help tailor treatment by determining whether you have malaria, which type of malarial parasite is causing your symptoms, if your infection is caused by a parasite resistant to certain drugs, whether the disease is affecting any of your vital organs. Some blood tests can take several days to complete, while others can produce results in less than 15 minutes. The type of drugs and the length of treatment will vary depending on which type of malaria parasite you have, the severity of your symptoms, and your age. The most common anti-malarial drugs include chloroquine, quinine sulfate, hydroxychloroquine, mefloquine, and combination of atovaquone and proguanil. You can prevent yourself from having malaria by following some basic guidelines, which include use of mosquito repellents, wearing full-sleeved cloths, cover water storages in your home, keep your home clean, and using mosquito nets.